Hi, everybody. I'm Jen Guanci, Creative Healthcare Management CEO, consultant, and a nurse for almost 50 years. As we celebrate Nurses Week 2025, I thought I would kick off the week by really taking a look at where we've come from, where nursing's roots began. I'm not going to talk about Florence Nightingale. I'm not going to talk about our other forerunners in nursing, but I want to go back, way back to the late 1800s and prior to the late 1800s and how nursing was viewed. The reality is way back in the late 1800s, there was no specialized training. We know that. We also know that if you were lucky and working as a nurse, you may have gotten a salary. However, back then, the individuals who functioned in the role of what we now say were early nurses were either nuns or women of ill repute. And that was believed because those were the only ones who could touch a male patient. It was considered a very unrespectable profession at that time. And people worked in deplorable conditions. Again, it was nuns or women of ill repute, and wealthy people didn't get care by these individuals. Wealthy people got care by physicians in their homes. So it's interesting, as I looked into the early days of nursing, I came across some interesting comments and advertisements for nursing. And I'd like to share those with you because I think, once you hear them, you'll understand just how far we have come. There's stuff still to be done, but how far we've come. So years ago, when they started advertising for nurses, they broke things up into categories. So let's talk about the age requirements. There were advertisements for nurses, and I'm going to read you verbatim what they said. 21 is a good age to begin, and 40 is a good age at which to retire. How many of you got that memo to retire at 40? I know I obviously missed it. They go on to say a woman is much older than a man at the age of 40. And by that time, a woman should have made some permanent provisions in life for herself. They didn't say it, but that meant you should be married. Few doctors will employ old nurses, and few patients care to have them. So apparently you were an old nurse at the age of 40. In that case, I am a relic. They also went on in these advertisements to talk about what they considered were characteristics of good nurses. And remember, when I say they, this is really a patriarchal advertisements, because back then women didn't work in, news or journalism, etc. So these advertisements were created by men. So the characteristics of a good nurse were such as, here are some examples. If she can dance, especially if she's an enthusiastic dancer, then it's a great advantage. And I look at that and I'm like, well, yeah, we do have to dance around a lot of issues in nursing. So maybe that's what they were talking about, although I doubt it. I don't think our forefathers thought that way. If in addition to being well formed, she is favored with good looks, it is all in her favor. For doctors readily recognize the influence of an attractive person in the management of refractory patients. So I guess it's your smile, it's your eyes, it's your hair, your good looks that help a patient get better, as opposed to our technical and scientific skills. Continuing on, again, this is in the late 1800s. Whilst recognizing the occasional utility of a man as a nurse, we are inclined to think that the occupation is one which is most safely left in the hands of women. They don't go on to say why it's most safely left in the hands of women. And we know today some of the best nurses that I've ever worked with are guys, and it's not just a woman's, profession. They go on and say the last characteristic that I'll share with you is tall and strong. Those that know me, I'm 5'1", so therefore I missed that memo as well. Tall and strong, who has a certain suppleness of movement, one accustomed to playing lawn tennis, who can ride and skate and row, makes the best material. So those of you out there listening to this, if you can't play tennis, if you can't ride a horse, if you can't row a boat, well, I guess maybe we're not the best material. So again, tongue in cheek with some of those. I'm just glad that we no longer look at those characteristics. They also went on to talk about the education that would be required for nursing. And that was, if the doctor will teach and the pupil is intelligent and willing, a very serviceable nurse may be improvised in a few hours. So again, with a smile on my face, I say, how many of you went to school for a few hours? And do we just want to be serviceable? Or do we want to really be able to function in the role of a nurse, the art and science of nursing? And then the final education statement that I will say is, there's no particular mystery about nursing, and the technicalities are easily acquired. Yeah, tell that to somebody who's learning how to do ECMO on a premature baby, or tell that to a transport nurse who needs to learn all about helicopter, pressures and that type of thing. So it really is just, I think, interesting for us to pause as we begin this Nurses Week to look at just how far we have come. And that being said, we still have a lot left to do. So I hope you've enjoyed this brief little history, walk down history lane. Thank you.